If you look at type 1 diabetic people, they are actually skinny.
Yeah, type 1 diabetes.
They're usually skinny. People think that surgery is like very, very bad, very aggressive, but there is a role for them as well.
Where it is needed, it is needed.
Yes. Avoiding saturated fats is example like?
Example would be animal fats, would be cigarettes from 10 to 12 a day. Would the cancer risk increase? Not as much, because you're already smoking 10 cigarettes. But someone who's not smoking at all, you start asking the person to start smoking, it would increase drastically, right? If you're eating nuts and seeds, and like you mentioned, the 10 to 15 nuts per day, that'll give you less than 30 grams only.
Indian cooking is mixed with oil a lot.
Lot of oils. And that's why you also see a dramatic improvement in terms of blood sugar level when you ask people to go whole food plant-based within 21 days.
The biggest problem sometimes they have is they get very hungry during the snack time. Tips and tricks for that?
So if you want a warmer snack, sundals are a great option. If you want colder snacks, then vegetables and air-fried sweet potatoes are a great option. So anything which is fiber-resistant starch. But now, growing up has an issue with overeating, not mindful eating, not chewing. Such a small thing, you don't pick it up. We are not supposed to be awake in the night. But people will say you're tossing and turning, sleep is not coming. Work on the sleep. Start inculcating practices for healthy sleep. Don't use your bedroom for anything but sleep and sex. Don't do anything. Don't eat on your bedroom. Don't have the TV on. Don't use it as your workstation.
Most important thing. People have laptop on the bed.
Laptop on the bed, exactly. So stop and then make sure you have a sleep routine. Classically condition your mind in terms of you don't have a routine. How will you fall asleep?
Hi Roshni.
Hi.
Hi again. And our first episode was wonderful discussion about, carb, protein, fats and everything. So I wanted to translate that into an actual clinical patient.
Yes.
So I can extract more information from you.
Yes.
Okay. So I'm going to present a patient to you. Okay. So in this podcast, we're going to talk about a diabetic patient. Okay. Yeah. And I will tell you a clinic patient that I saw in my office. So he came in with abdominal bloating. Okay, and early fullness. What it means is as soon as he eats, he feels full. Okay, and then this is a very common symptom that we usually see, and most of the times it ends up, it could be an ulcer in the stomach, or if they're more than 50, 60 Asian patient, then it could be pre-malignancy or malignancy, something like that. So early fullness and bloating is considered a red flag. So we do an endoscopy. Endoscopy was good, everything was good. Then turned out to be he's a new onset diabetic. The reason that he's feeling early fullness, as soon as he eats, he feels full, is because the body is filled with sugar, and the sugar is making the nerves not working properly. So the nerve supplying the stomach is not working to a point that it is paralyzed.
Yes.
So we call this as gastroparesis, stomach being paralyzed because of excess sugar in the body.
Interesting.
And that was a first manifestation symptom for that particular patient. So then he asked me, I said, the treatment is nothing gastroenterological at all. The first treatment is you need to decrease your sugar level so that your nerves can start acting again. So your A1C was 7.3, 7.5, something like that. But apparently it's been going on for a while. That's why he has that much amount of symptoms. I said, bring it down to 6.4 somehow. If not, this symptom is not going to go away. So he said, okay, what should I do? I said, you need a dietitian. You need to understand everything. So let's say I refer that particular patient. He is like 45-year-old and he comes to you. Many patients on that age are also pre-diabetic as well. What is the first thing that you do in your practice?
The first thing which we do is ask the patient, has anyone taken the time to explain you what is diabetes? Yeah, because
so you put the blame back on the doctor.
I think because
nice.
doctors are busy, we have our jobs. See, this is
of course, that's really true.
Yeah, no, but we don't have, and I think just having the understanding of what diabetes is literally finding your cure, because you understand now what is causing diabetes. And I've asked this to multiple patients through working with them as a nutritionist on my team and dietitians on my team. I've asked them so many times. I think 1 out of 100 will tell us yes, but just imagine that ratio. It is so big, and all the others will be fumbling with words. Yes, sugar, yes, insulin, but they don't really know what is going on. So I think I'm going to try and break it down into very simple, easy to understand terms. And while I'm explaining, it's not going to be scientific because I'm trying to explain people what diabetes is. So imagine you're eating food, any food you're eating. Food is breaking down into these molecules called glucose or sugar, and that glucose stays in your blood. Now, there's a problem with glucose in the blood. Glucose in the blood can cause a problem, but glucose is very, very important for functioning of everything. If your heart has to beat, if you have to breathe, if your brain has to function, anything has to function, you need glucose. So, glucose is not the villain. Glucose in the blood is the villain. So, we need that part clarified. But like I said, because glucose is not the villain, it's actually the hero of your story. You need glucose to function, you'll die without it. Glucose has to be taken up by your muscle cells to function.
Correct.
Okay. And this process of the glucose is over here, muscle cell is here. Process of the glucose entering the muscle cell will require a key, like a door and a lock. You need to open the muscle cell, then the glucose will be able to enter. Without the door opening, it will not enter. And who opens this door? This key is this hormone called insulin, which is released in your pancreas. So when you're eating, pancreas are going into high alert and saying, we need to send the keys. You have to go and open the door. Without the door, the glucose is going to stay in your blood, and that's a problem. So the pancreas are releasing this thing called insulin, which is going and trying to then open the key. Now, imagine you had a chewing gum stuck in the lock. The key is not going to work. So, separate scenario, you're going home and you're trying to open your home door and the chewing gum is stuck in the lock. It's not opening. Is the key faulty? No. It's not the key. Is the door faulty? Will you leave and say, I'm going to a different house, this house is not working? It's not. The problem is the chewing gum is there, no? We have to remove the chewing gum first. Then the key will work. There's no problem with regard to the door. Nothing. The chewing gum needs to be removed. This chewing gum is what we term as intramyocellular fat. IMF, intramyocellular fat. So these fat cells in your muscle cells are blocking the insulin from doing its job. And because it's blocking the insulin from doing its job, the glucose will stay in your blood, causing a rise in your blood sugar. So when you're measuring and you're seeing the 200 blood sugar, that's because it's not taken up by your muscle cells. And it's not taken up by your muscle cells because there's a jam or intramyocellular fat, like a layer of fat cells, not a layer, fat cells around your muscle cells. If you can get rid of that, the key will start working again. That is diabetes. So that is type 2 diabetes. Type 1 is a different story and we label it in the same thing. Ideally, I think it should be separate problems. But that is type 2 diabetes, when the insulin is produced in excess, but it's not working because of intramyocellular fat cells.
Correct. So type 1 is there is no insulin at all. Type 2 is there's so much insulin, but it's not working.
It's not working.
Because of the blockage and everything.
And type 1 is an autoimmune condition. Autoimmune as in your body itself is attacking the pancreas, which is making the insulin. And you have excess autoimmune antibodies, insulin autoimmune antibodies, because of which your body is attacking. So there's a separate issue going on. And here the problem is there's a jam. There's an intramyocellular fat problem.
Correct. The intramyocellular fat is linked to gut bacteria.
Yeah. It's linked, everything,
So the gut bacteria, because if let's say there is a damage in the gut bacteria, right? Or you have an increased proportion of bad gut bacteria compared to good gut bacteria, there is a hormonal imbalance in a hormone called adiponectin. Adiponectin is a hormone which tries to balance the adipose tissue. Why Indian community have an ethnicity to have a tendency to put belly fat is because of this adipose tissue hypothesis, where the adiponectin is supposed to work properly, where there is this transmembrane fatty acid reflux. So everything is on the outside subcutaneous tissue, but we don't have that much amount of subcutaneous area to store the fat. All the fat is spilled into visceral fat. Visceral fat. And the visceral fat is being spread into intramyocellular fat. And then whatever you explained makes sense.
People, especially when I have diabetes and I'm explaining this whole story to them, and then they say, no, but I'm not fat. How will I have intramyocellular fat? It has nothing to do with your subcutaneous. Subcutaneous fat is the layer of fat below your skin. So you have visible obesity. You could be in your ideal body weight range and still have intramyocellular fat.
Correct.
Yeah.
So if you look at type 1 diabetic people, they are actually skinny.
Yeah, type 1 diabetes is
They're
actually
usually
skinny.
skinny.
Yeah.
And type 2, it's because of the obesity, insulin resistance, you develop obesity, and that's why many people are recommended when you lose weight, your insulin resistance will also
Comes down.
improve because the IMF
Yeah.
will also decrease
Yeah.
eventually.
Yeah. In fact, one of the few things with even if you're losing weight through bariatric surgery or something, you still see an improvement in insulin resistance
Correct.
because you're getting rid of a lot of the visceral fat and intramuscular fat.
Yes.
Yeah.
A small comment on bariatric surgery is people think that surgery is like very, very bad and bariatric surgeries are very, very aggressive. But there is a role for them as well.
Where it is needed, it is needed.
Yes.
Yeah.
So people think bariatric surgery is only for people who are like 200 kilos, 300 kilos. Yes, they need bariatric surgery, but there is an indication for group of people where your body mass index is only 32, 33.
Yeah.
But they have associated problems. We call it as
Obesity.
comorbidities. Where it could be high blood pressure,
Yeah.
diabetes, or sleep apnea.
Yeah.
So body mass index more than 30 with any other comorbidities, they also
Puts you at the
meet the
risk of
criteria
death,
for bariatric surgery.
Yeah.
Right. So I just mentioned that because you mentioned about bariatric surgery. So with this, you explain what is diabetes to the patient.
Yeah.
Okay, so I'm sold. So what will you say now? What will you do with me now?
So because now we know what diabetes is, we label diabetes as the glucose carbohydrate intolerance. Okay, I'll just say that again because it's important. We label diabetes as carbohydrate intolerance. Yeah, because even though all the proteins which we are eating, a percentage of that is also broken down into glucose. Fats can also be converted into glucose, but predominantly when you're eating carbohydrates, they are broken down into glucose. So, what is the treatment? Now, the treatment is I realize that every time I'm running up and down the stairs really fast, I fall down and I get a fracture. Okay, that's this thing. So, what will I do? I'll stop running for the rest of my life. I have to work on my agility, right?
Correct.
Okay, so one way of looking at it is stop eating carbs. It's a carbohydrate intolerance. It's not happening with proteins or fats, no. So you stop eating all carbs, it will stop happening. No, you've not removed the lock. You've not removed the chewing gum. If you remove the chewing gum, then it doesn't matter if you're eating carbs or not. It's not going to cause your blood sugar to rise. Right now, the chewing gum is there. That's why it's rising. So actually, if you're looking at pre-diabetes remission, getting your pre-diabetes completely into no diabetes state, getting your HbA1c down, or even diabetes towards remission, get rid of that intracellular fat. How do you do that? Various methods. Work on your gut health is one thing. You have to work on your gut health. Obesity management is another. Third, stop eating foods which are causing intracellular fat. Fourth, eat fibers which will help you clean that out. Okay, so if you can take care of these things, and fibers found where? Carbohydrates. Yeah, so if you go on a low carb, you inevitably sort of go on a low fiber diet unless you very carefully plan it, which is difficult. And then you have to keep measuring food all the time.
Correct.
I can eat this, I can't eat this, this much grams only is allowed because the chewing gum is still there. So if you want to technically go towards, getting your body to function like it used to function before, carbohydrate should be looked at as one part, but cleaning up this intracellular fat should become the primary focus. Yeah. So now when you're explaining this to client, they can say, oh, then I can eat roti. Then I can eat rice. Yes, let's work on cleaning up that lock. Then you can eat what you were eating before and we can get you to a state. That means reducing obesity. It means reducing obesity. But at least you'll get to a state where you were eating the foods which you're used to eating.
Correct. So in your practice, do you say like grams of carbs per day?
We don't, unless it's a type 1 diabetes. Yes, we have to calculate because then insulin dosage depends on that. But otherwise, as long as you're whole food plant-based, you're working on actively cleaning up that lock, which is two processes. Number one, high fiber to help you clean up and improve your gut health. Again, to help you clean up. Number two, stop eating fats. That's what's causing the intracellular fats. Yeah, and specifically saturated fats. So if you can take care of these two things, you don't really have to do carbohydrate counting. In fact, we have diabetes patients eating 200-250 grams of unprocessed whole food, plant-based carbohydrates and not having to worry about, we only see an improvement in A1Cs. We don't see decline.
So avoiding saturated fats is example like?
Example would be animal fats, would be ghee or certain kinds of oils like coconut oil. Is again saturated fats and ultra processed foods.
But there is a controversy around this, right?
About saturated fats?
I mean,
yeah.
we cannot completely say, you should avoid coconut oil, ghee altogether.
Yeah, so it's interesting. Coconut oil, from the perspective of it has certain monounsaturated fatty acids. But if you look at the amount, it's very less compared to the saturated fats, number one. Second thing, let's say you have a smoker smoking 10 cigarettes a day. Yeah. And you have a person who's not smoking at all. And you have the smoker increase his cigarettes from 10 to 12 a day. Would the cancer risk increase? Not as much, because you're already smoking 10 cigarettes a day. But someone who's not smoking at all, you start asking the person to start smoking, it would increase drastically, right? So this is the same with some of these cholesterol studies where you're saying that someone eating a high cholesterol diet, you're adding a little bit more saturated fats to their diet, their risk of heart disease is not dramatically increasing because you're already starting with a large amount of, so where they are, they're going to stay at there. But someone who's on a low cholesterol, low saturated fat diet, you're adding some, you see a drastic increase in terms of their risk. So some part is that. And there's also some studies I read where you're comparing two evils. You're comparing like, butter to like something which is even more unhealthier. You're comparing ghee to something even more unhealthier than ghee. Then ghee does better than something which is like animal lard and ghee. Then ghee will do better. But in that cases, you can't say that one evil is better than the evil, so it's not an evil. It would. Yeah. So, and when I'm saying we want to keep the fats low, we want to keep it at about 15%, 20% of the total calories, no more than that. And that is actually quite a lot of fat. It's not like a low fat.
So in a 2000 calorie diet, 15-20% would be
30 grams,
30 grams,
35-40 grams, 35 grams. Yeah.
But that's so low.
That's why oil-free cooking. Yeah, so I think our concentration of fats comes in from processed fats, which is oils and ghee.
I see.
If you're eating nuts and seeds, and like you mentioned, the 10 to 15 nuts per day, that'll give you less than 30 grams. Yeah.
But Indian cooking is mixed with oil a lot.
Lot of oil. Yeah. Lot of oil use. And that's why you also see a dramatic improvement in terms of blood sugar level when you ask people to go whole food plant-based within 21 days. Sometimes even lesser. So we have clients and we meticulously measure. It is important. Diabetes cannot be taken for granted. At least 3 times in a week, we do fasting glucose and then postprandial glucose. And you see week 1, week 2, by week 3. By week 2 itself and by week 3, a drastic difference. HbA1c is going down within a span of 3 months. 3 months is what we asked them to test.
Correct.
Earlier, but like 3 months. And we see this drastic improvement. No calorie counting. Don't have to worry about carbohydrate counting. Changing towards whole food plant-based, keeping it lower in terms of fat content. Yeah.
So, you're decreasing the overall clinical profile in terms of your diabetic patient. The biggest problem sometimes they have is they get very hungry during the snack time. Right? So, tips and tricks for that?
We do include snacks. I think it's the number of meals per day should be very lifestyle based. You can't do 2 meals for all, 1 meal for all,
Correct.
3 meals for all. It has to be very lifestyle based. If I do realize a client is very busy in the lunchtime and does not have time, genuinely, I'll make sure that it's a dry meal. You can't do a roti, sabzi, dal, chawal. You're busy, you're working, you're doing multiple things. But having a sandwich or a wrap or a dry meal is easier. So I would do it very specific to that. But when it comes to snacking options, if you're looking for, again, fiber and resistant starch rich. So if you want a warmer snack, sundals are a great option, purials are a great option, those kinds of things. If you want, colder snacks, then vegetables and air fried sweet potatoes are a great option. So anything which is fiber, resistant starch. We are always looking at 2 things. How do I clean up intracellular fat? How do I stop it from forming?
Okay. So when you say how do I clean up, I thought clean up the kitchen.
Yeah.
No, intracellular. So you mentioned air fryer.
Yeah.
Okay, in your terms, how do you practice?
I think we are a generation right now of convenience. If that is keeping you from eating something which is even more processed, it's a very fair price. Air fryer becomes a problem when you're cooking a protein or a fat because of the release of AGEs, advanced glycation products. Carbohydrates don't have AGE. So you could do vegetables air frying and it's okay. It's not a problem. But if it's like a tofu, I would cook it on the stove versus trying to air fry.
Example of a vegetable air fryer?
You could air fry vegetables in the air fryer. Like sweet potatoes are great. I love doing carrots because it has a really nice caramelized flavor to it.
Your recipe is you cut the carrots or whole carrots?
Just cut it.
Cut the carrots.
Cut the carrots, adding a little salt and pepper and just air frying. That's it. Yeah.
How many minutes?
20-25 minutes, but turn it halfway through at about 180 to 200 degrees. That's what I'm doing at home.
Oh, nice.
And it's amazing. Kale turns out amazing too. I know kale is not very, if you live in metro cities, of course, you have access to a lot of kale. Yeah, it's grown locally and it belongs to the cabbage family. So it's not like a Western concept. We grow it here. We never knew it was kale. Now we know, so we're using it. But a movie night snack, which is pretty famous in my house, is kale chips air fried with a little bit of nutritional yeast and salt and pepper. And it's very crispy. It has, because cruciferous vegetables, when you air fry them, they have a beautiful caramelized flavor. So if you're air frying, like we recently made cabbage pakoras in the air fryer, which was basin flour with cabbage, and they chopped a little bit of green chilies and stuff. And it has this really nice caramelized flavor. So cabbage, broccoli, cruciferous vegetables, cauliflower has a really nice caramelized flavor. And cruciferous vegetables are generally very, very healthy for you in terms of disease prevention, reduce cancer risk. So many things, so many properties. So we like to do that, which is very easy, not very difficult to do.
Good. So wonderful snack option. I'm going to try it out.
Yeah.
So carrots, cut it out and then the 20 minutes.
Yeah.
Air fryer. So do you hummus? You can use hummus as well for carrots, right?
Yeah, you can use hummus. You can have by yourself. When we are looking at, humans are not designed to go on eating. Don't constantly keep eating. So let's say I do have a client who's saying every 2 hours I'm getting hungry. I would explore things like that. It's a gastric emptying. Is it satiety hormone secretion, hunger hormone? I would explore. Is it from boredom? Is it from past lifestyle habits? So we want to start exploring. I think, we do have clients and our upbringing plays a big role in terms of that. So where we had a client where resources were less growing up. So it was him and his sibling all the time. And because resources were left, it was always a fight for, food. Small thing, you don't even think about it. But now growing up has an issue with overeating, not mindful eating, not chewing. Such a small thing. You don't pick it up. But just working in terms of helping the person develop mindful eating habits and saying, it's okay, it's all yours. Don't worry. But then if that is taken care of and you're eating nutritionally dense food for your main meals, you're not going to want to snack multiple times. Yeah. So I want to understand the habit. Why are you snacking?
I see.
So many times. Then help the person fix the habit.
So I'll tell my patients to play a game where they taste the food and then tell the ingredients to the cook who made the recipe.
That's amazing. That's really amazing. You know why? Not only will it slow them down in terms of eating and more mindfulness, but it's also taking a moment to appreciate the person who's cooked for you.
Correct.
Which we don't give credit to. Which we never give credit to.
Of course. My wife doesn't give it to me. But sometimes I don't cook properly at all. So that's one of the... Actually, if you ask them to chew properly, don't look at your phone, don't look at your TV, that's not going to happen. I at least in my practice, I've not seen any success with that. But this one, they are at least appreciating the taste.
Yes.
And then some people are very connoisseur of the taste, but not many people actually appreciate the taste either. They just eat food and then just keep on. So that is one thing I always tell my patients. And what is happening when you're doing the mindful eating, similar to how you're practicing, is your parasympathetic tone kicks in.
Exactly.
So the vagal tone kicks in, so which helps the digestion a lot better.
Yeah.
A lot better.
Yeah.
So I say that to all my patients, and especially for diabetic patients.
Yeah.
So for diabetic patients, white rice or brown rice?
We do see a little bit benefit when people switch from white rice to brown rice. I want to say there was a study which showed 16-20% better in terms of, in that range. I'm not sure of the number, but 16 to 20% better blood glucose control in terms of fasting glucose, getting better. And that's a huge number. For someone with diabetes, that is a big number. So we do see a benefit. I think what we are trying to work, when it comes to nutrition, it's unlike a scientist studying and saying this is the right practice. But when it comes to nutrition, it's more in person.
Yes.
You're working with real people who will not listen to you. They will listen to you. So we have to find a way to make it their lifestyle. And especially, I practice in Bangalore. Many clients I'm seeing are South Indians. Their rice is staple. I grew up in Bangalore. Rice is staple in my house. So I think if I can just get them to understand that diversity of grains is very important. You like your white rice? Okay, let's do it 2 days of a week. Let's keep the other days for millets or brown rice or but diversity, and translate it. It's a win-win. They feel they've walked out of the consultation getting what they want, and they are more likely to follow. But if you only do brown rice, we all know it is unprocessed is definitely better, and the more whole the food is, it's definitely better. So I think doing this where a few times, if you're doing white rice, it's okay as long as you're doing a diversity of grains in your other meals. But brown trumps white.
Yeah. And also the amount matters as well.
Amount matters if you're not following a lifestyle. So what I also tell my patient, that's why we don't do calorie counting, because it does play with your mind. I'm only allowed 1 cup. Now I'm hungry. Now someone told me I can't have more than 1 cup, I'm hungry. So what we do in our practice instead is lifestyle changes. Start your meal raw. Start your meal raw, meaning let first part of your meal be salad, and it's a part 1, part 2. So it should have equal weightage. You can't have little salad and then, so it's a part 1, part 2. So it should have equal weightage. So let's say you have a bowl of salad. Salad forces you to slow down. It is raw food. It requires more chewing. It is also an appetite suppressor. It's barely any calories, but very rich in terms of volume. It's a lot of food to eat, but not many calories. And it is also high in nutrients, vitamins and minerals which you're getting. So when you're starting your meal with a salad, then I don't have to tell someone only 2 chapati, not 3. Because you've started your full by the time. But let's say we start off with, you reduce your carbohydrate quantity or fiber or whatever quantity of food, then it becomes like a mind game of I'm on a diet, that's why I'm not allowed to eat this. You do this first, after this you do whatever you want, automatically the second part is
taken care of. Okay. Yeah. In your practice, do you do like time restricted feeding or fasting in diabetes patients?
Yeah. I love the concept of time restricted eating. So much benefits and really very easy to do. And you don't have to go the 16, 18 hours. You start seeing the benefits in 12 hours. So it is, just 12 hours of fasting, giving your stomach a break, and 12 hours of feeding is also good. You want to take it up a little bit more, it's okay. And then depending on your hormonal balance, and work with someone who understands and can easily inculcate into your practice. But I think 12 hours is such an easy practice to, introduce. What I see a lot of people doing wrong, number one, with diabetes, if you're taking insulin or medication and you're doing time restricted eating, you might get into hypoglycemia, which is very low blood sugar levels, and that is, it's not good. It's not healthy for you, because you'll have fluctuations are not good, and hypoglycemia itself puts you at a risk of various things, including coma. So you could pass out. So when you're doing time restricted eating and you're diabetic, work with someone, especially if you're whole food plant-based, you will start seeing your blood glucose drop drastically. Your health is improving. You've cleared up those, chewing gums. So it's starting to improve. You don't need that much medication. That's why we always work with a diabetologist with us. So as you're healing, you're seeing your measurements, you're seeing your numbers, the diabetologist will help you in terms of tweaking your dosage of medication. So time restricted eating, number one, I see people making a mistake. With diabetes, you're trying to do it by yourself. Don't do it. Second mistake I see is people do a very late feeding window. Yeah. So that means most of your calories are towards the end of the day. And we associate this, because food is associated with pleasure generally. Correct. And we feel that you be strict first half of the day. I can eat whatever I want in the evening. Also, mostly dinners is a time family sitting together. Correct. So you want to sit and so you'd rather skip breakfast. You're busy. You're not thinking about food, but you want to have dinner. That's a problem. Yeah. So if you see some studies done where you've had the feeding window either in the morning 4 hours or the evening 4 hours, while the weight loss might be similar, the percentage of body fat drop versus muscle mass drop is different. People who are fasting later in the night are doing better, but people who are fasting in the morning and eating in the night, the feeding windows in the night, you see chronic disease markers not improve as much, or you don't see the body fat percentage is going up and the muscle mass is dropping. So you do see this difference with regard to. So my suggestion is, if you're doing time restricted eating, do it with the sun cycle. Yeah. So by 7 p.m., finish your window. And nutritionist, you'll have people with different views. There'll be people who will say keto is better. There'll be people who say high protein. Not a single nutritionist will tell you wake up in the middle of the night and eat. One thing we all agree upon, doctors, nutritionists, everyone agrees upon, don't eat in the night.
Right. I've heard this somewhere.
Yeah?
I think in my channel.
In the channel that nutritionists will not...
No, in my channel. where I
in
say.
my channel. Okay. Yeah. So that is one thing that don't wake up in the middle of the night and eat. So that is very, very important to remember, that keep your fasting window as early as possible. Majority of your calories with diabetes management should be in the first half of the day. Yeah, the breakfast and the lunch part of, keep it lighter towards the evening part.
So in my practice, I'm a big proponent of time restricted feeding, and I think it's a very sustainable method.
Very sustainable.
Method. And we start with 12 hours and we maximize to 16 hours if possible.
Yeah.
We're very careful on diabetes patients. They are very brittle.
See, you see the hypoglycemia, right?
The fluctuations so much.
Yes, so much.
Because the body is anticipating food.
Exactly.
And when you don't there could be a crash and everything.
Exactly.
Especially when they're on insulin.
Yes.
So let's say they are on oral hypoglycemics, where it's a tablet like
metformin
metformin and glipizide. So then the fluctuation is not that much.
Yes, but that's also because they have better control. HbA1c is not very high.
Correct.
Yeah.
You will not believe the cutoff for insulin requirement for A1C level. So before A1C level more than 10, then you give insulin.
How much is it now?
Now it's very low, even more than 7.
But is this in India and the US, both are the similar?
American Diabetes Association is recommending earlier insulin because the better control of glucose levels
risk
sooner.
Of chronic disease, other comorbidities.
Correct.
Yeah.
But there is this hesitancy where, no, you will be dependent on insulin for a long time. That is not true.
That's not true.
That's not true at all. So you will take insulin and lifestyle changes. I've seen many patients taken off of insulin, as you might have seen. Yeah. It's just a matter of that removing their IMF, chewing gum that you talked about. Because the insulin is ready to act.
Exactly.
It's just a matter that you need to give rest to the insulin.
That's why we differentiate. Type 2 is not type 1.
Correct.
It's different.
Correct.
So it's you don't have to treat it like. Yeah.
So when a patient is on hemoglobin A1C of 10 and on insulin, time restricted feeding can be tricky.
Yeah.
Hemoglobin A1C of 7, 7.5 on insulin is okay.
Yeah.
But most of the Indian patients that I have seen is they're not on insulin on that particular
It's
A1C.
Not. Even on the HbA1c of 10 to 12, I think it's not resistance mode, because they come and they tell us that doctor told me not needed. The doctor probably told needed, and they are. I think it's more of a resistance of having to poke yourself.
Yes. That's the key thing. And the other thing is that once you are on insulin, you think that you are on insulin forever.
And that's not true.
That's not true either. That's not true either. So what I do is I maximize the time restricted feeding as much as possible. And then I say that, so let's say that you want to start your day at 8 a.m. or 9 a.m. First thing is 12 hours, 9 a.m. to 9 p.m. And then you decrease the dinner time as much as possible.
As much as possible. Yeah.
Wow.
And that can only be possible if your sleep is optimal. You can't be sleeping at 1 a.m. You can't, in fact.
Yes, because you will start feeling hungry.
You will start feeling hungry, and then you can't rely. Not only that, but circadian cycle being off is a cause itself for insulin resistance. For instance, there was this study done with women. Women who sleep with light completely off in the room. This is a circadian cycle and light cues, what we get from the environment. So light completely off in the room. Second group with a light on in the room, and the third group with a TV on in the room, and no other difference with regard to lifestyle. And you see that the women with light off in the room tend to develop lesser risk for insulin resistance later in life. So that is very interesting to see that we are not supposed to be awake in the night. But people will say you're tossing and turning, sleep is not coming. Work on the sleep. It's not. So start inculcating practices for healthy sleep.
Correct.
And there's many things you can do in terms of that. Starting with, don't use your bedroom for anything but sleep and sex. Don't do anything. Don't eat on your bedroom. Don't have the TV on. Don't use it as your, workstation.
Yes, that's the most important thing. People have laptop on the bed.
Laptop on the bed, exactly. So stop and then make sure you have a sleep routine.
Correct.
Classically condition your mind in terms of you don't have a routine, how will you fall asleep?
Yes. The most important factor that might help you in good sleep is going to sleep 3 hours after
your
meals, or eating 3 hours before you go to bed.
Exactly.
That's the most important thing that people should do. And the worst thing to do is to have dinner and then go to sleep right away.
Go to sleep. Yeah.
Because your digestive hormones are so active and your body is so confused in terms of what do you want me to do?
What it needs to do. Yeah.
And that is why if you people listening to this podcast, they can ask the friends around. Let's say they are having dinner and going to bed right away. In the morning, they are going to be groggy.
They're going to be groggy. Plus, if you have a sleep ring or a watch, you're tracking your sleep, you will see that your deep sleep is not as
Correct.
deep because you've just eaten, you didn't do any activity, and you just went to sleep. So you can see this different in your sleep score when you're sleeping right after a meal, or you're not exercising, not exercising, walking. Basic, just allow yourself the time to finish the digestion process and then go to bed.
Wonderful.
Yeah.
A diabetic patient or any normal patient, when they go out for a restaurant, what are your tips and tricks?
I think we stick to, if it depends on the HbA1c, but if the HbA1c is in the higher range, whole food plant based. So give yourself, because it's like saying that right now I have a fracture and you're telling me don't dance. How can I not dance? It's not practically possible, but I have to dance. Everyone is dancing. Right now you have a fracture. Don't dance. No, but I will dance. You will get another fracture. Right now you have a fracture. So you can't do the socializing this, that when you have a chronic disease right now. Will the fracture ever get off? Yes. There'll be a time when the fracture will get off. Your HbA1c will come down. You'll be in a pre-diabetic. You'll come into remission. Then can I go out and dance? You should. Go out, because that's a social activity. But right now you have a fracture. So I think that understanding should be there when I'm fighting through a chronic disease. Don't think about, but my social life, but my this. There are other factors. Right now, heal your body. And then when you come to a remission state, I think that 80-20, which applies to everyone, all of us, we live in the world of hyperpalatable food. How will you avoid it? We live. I'll walk down from here. There are 3 to 4 in this lane itself. The street vendors which are there. So we are living in that world. You open any app, you have advertisement for food.
Yes.
And I think I would say, the most beautiful time to be alive, when you can combine, you did the pizza idli.
Correct.
You'll not have this anytime. You won't have this. So I think you give yourself that 20% of enjoy, but 80% you have to. And when you have a fracture, you have a fracture. So I think you take a step back in terms of, so when I do have diabetes patients, choose whole food plant-based restaurants are there. You choose that. Let the HbA1c come down. And then you have the option to include a lot more freedom, and it's okay. Yeah.
So you're recommending against any animal protein at
Absolutely.
all?
Yeah, I know. And I think it becomes harder in terms of people understanding, no, but I want to eat and a little bit and inclusion. The best approach is this. Even as if you compare the American Dietetic Association diet with a whole food plant-based diet, which they have been studies done by Dr. Neil Barnard and PCRM, Physicians Committee of Responsible Medicine, you see more compliance and sustainability with a whole food plant-based diet, which was American Diabetic Association recommended diet. Because it is calculation, it's meticulous, it's controlling. And here it is, you eat whatever you want to eat, but keep it low fat and keep it free of animal products. Now, do I have patients who say that, no, I want to include a little bit of animal products? And we do see that if you're maintaining an 80-20 ratio, you still see improvement. You will see. It's not that you're not going to see. But when someone's HbA1c is high, it's my moral responsibility to tell you, this is the best method for you. Then I can't, ethically, I would be telling you the wrong thing, that it's okay, you eat a little bit. And I think we have trouble with moderation. I don't think we have full. I do realize that we have a moderation problem.
Of
That
course.
we
My
don't think-
favorite phrase is moderation is key.
Yeah.
For which we have lost the key.
Yeah, I agree. Yeah. So I think that is, we have to be mindful in terms of the choices you're making. Will you see an improvement with 80-20? That's a Mediterranean diet. Mediterranean diet is an 80% plant-based and 20% inclusion of, animal protein. And they do very, very well. So yes, we do see an improvement with that also. So I think we want to see where it really becomes, let's say you restrict yourself to one meal. I'll go out with friends and I'll enjoy that has animal protein. But the rest of the week, I'll eat healthy. And you find a way to make healthy and tasty. Otherwise, you won't stick to it. Yeah. You're obviously going to see a lot of improvement. I think for me, when I look at it from moderation perspective, I was, today is just a breakfast buffet because we are staying at a hotel. You go down. Yeah. There were a series of dessert spreads for breakfast buffet. So you had croissants and muffins and so much of sugary and sweet desserts. And because I follow a whole food plant-based lifestyle, and plant-based desserts are very rare to find, milk and everything, I couldn't eat anything. Yeah, but because I follow the whole food plant-based lifestyle, I couldn't eat. Had I done the moderation, I would have a little bit today, I will have a little bit tomorrow. And in my mind, I'm going on convincing myself it's a little bit only. It's less than 20%. But that becomes harder. So that way, moderation becomes harder when that's why it's a lifestyle. It's not a dietary choice. It's this is the lifestyle I want to do. My lifestyle will be whole food, plant-based. So you go out and options and...
So then what do you do for desserts then?
Oh, so many vegan desserts. There's ways to cheat. There's a lot of ways to cheat. I was in Spain recently. We've had desserts and burgers every single day. And that's a lot of vegan, of course. But like so many different options are there. So if I had to find it, in fact, I remember last night I was trying to Google who will deliver me vegan ice cream. So there are ways you can get it if you want to, but it's a little bit inconvenient. And because it's inconvenient, it becomes easier to follow the lifestyle much easier.
Yeah.
But I think that's when you have a fracture, that time don't dance. So that time give yourself and it's easier to stick to it. And when you do, when you are healed, you're in a better position, you have the freedom.
But I'm going to be very practical with you. Even when you have a fracture, it is better to get a fracture rather than finding.
The thing. Yeah, that's the mindset. And that I think we also want to start thinking that accessibility. Yeah. So because we are in Bombay, some of the foods, vada pav, misal pav, sev puri, masala puri, bhel puri, everything is vegan only. So its options are there. So in our mind, we put this thing, that it's not the idli, dosa is all vegan. It's vegan food by nature. So there's way. Second, we think that it is not tasty. That concept has to change. It's much, much more tastier than. So that concept, I think one of the reason we find whole food plant-based desserts tastier, you're tasting the real ingredients. Now you have the cashew taste and the dates and you're tasting these. Otherwise, it's only sugar. Yeah. So I think that concept, people need to start realizing accessibility is there. It's cheaper. It's not that it's more expensive also. And second thing, it is tasty. It's just about trying to find the options.
So in your WFPB, like whole foods, plant-based diets, there is no role for animal products at all?
No animal products.
I see. Yeah. I differ a little bit where I say that, I mean in terms of convenience.
Yeah.
I'm just saying if you can do that, well, I kudos to you. It's you have surpassed the inconvenience and made that into a lifestyle, which is very good. Busy professionals like us and who for us that inconvenience is a little bit more, I go for plant forward diet.
Plant forward.
Yeah. Where the same 80-20, where 80 is plant, 20 is animals, animal based. But I understand that there is a slight compromise that I'm doing.
Yeah.
And I will compensate in terms of increasing the fiber and increasing the plant and everything. So which is suitable for my lifestyle.
Yes.
And that is where people had loggerheads that are, you said this is bad. You said this is bad. So you cannot do like that because everything is individualized.
Yeah. You have to find your lifestyle practice. So it's very interesting in terms of when I tell lifestyle, I keep example, if I'm telling a client to walk 7,500 steps a day. The concept is walk 7,500 steps a day. And then the client comes up with counter argument. But that study was done by people who promote the pedometer and how it's not real and they're making profits. This is the thing. In my mind, what I'm thinking is, when you're sitting on the sofa, imagine you and your sibling are sitting on the sofa, you're watching TV and the doorbell rings. One of the person will instantly get up, run towards the door to open. The other sibling will sit back, relax and say, go.
Yeah.
Always, yeah. And you will see that the person who instantly gets up is the person who's healthier. The one who says, go, then we say that, no, it's my metabolism is low. No, that my food, the way I'm dieting, then also not losing. No, the problem is that you have to develop the attitude for getting up and going. How do you develop the attitude? So when I'm saying a client walk 7,500 steps a day and there's a follow-up message in the evening, did you watch it? Send me your screenshot of the pedometer. And they've just signed up 2-3 days back. They are getting irritated of me. What is this? I have to pay the money. I have to walk. What is this? And it's about 8 p.m., 10 p.m. is their bedtime. Irritated, angry, but because they are paid, they'll do rounds around their bed. They'll send a picture and they'll go to sleep. Second day, again, they'll forget throughout the day, rounds around the bed, send a picture, go to sleep. Third day, when they're reaching work, they've called for the lift and they're thinking, I'm doing rounds anyways around the bed. Let me take the stairs. Some steps will happen. Correct? Fourth day, fifth day, sixth day, after a month, they'll be the one who instantly get up and open the door. Now, I haven't told. Now, it's not about 7,000 getting results or which study was done. The important thing is I've inculcated the attitudinal trait
Correct.
to move more.
Mm.
That is a lifestyle.
Mm.
Yeah. So if you can make something part of your lifestyle, adopt it. I think 80-20 is fantastic because that's also a healthy step in the right direction. And this way you made it a lifestyle also.
Correct.
Yeah.
Correct.
So find a way to make things a lifestyle.
Incorporate into your daily lifestyle. And that is where these consistency always trumps as well.
Yes. Yeah.
So there are only 2 C's. I always say 3 C's is consistency and convenience will lead to comfort.
Wow. Amazing. Amazing.
Yeah, that's what I usually say. Consistency and convenience. And you as a person, individual person, along with your family, need to decide
which
which convenience is good for you.
Exactly.
Instead of saying that, okay, your principle is wrong, everybody has to come to a conclusion that, okay, it is based on your individual bioavailability and your bioavailability of your environment.
It's very important. Otherwise, there's constant fights.
Food
fights in the family are very difficult. Very difficult because the cook gets frustrated. You want oil free. This one wants with oil. This one wants junk food. This one wants keto diet. So it's very frustrating for the cook. So, yeah.
So before we wrap this, I'm going to ask you one thing. What is the one thing that a diabetic patient coming to you wish they can change?
Understanding, I think the knowledge right now, we've explained one way to reduce your blood sugars, also stop eating foods which are raising, which is carbohydrates. But that's not the solution. That's, you have a wound, putting a bandage on that, understand why you got the wound so you don't repeat it in the future. But band-aiding is not a solution. That's why with a high-fat diet, you'll see results because you're not challenging your system. You're eating only fats. You're not eating carbohydrates. You're not challenging the system. Like keto. But that's not reversal, no? In fact, if anything, your carbohydrate intolerance goes up further because more intramuscular fats are forming. So long-term intolerance, then even if you eat a little bit of a banana, suddenly you're seeing a glucose spike, which is not supposed to happen. So I think that understanding perspective, that's why a problem I have with CGM devices. Yeah. Very important. Type 1 diabetes, you need it. It gives us so much of insights. I think uncontrolled diabetes, you need it. You're going into hypoglycemia, suddenly sugars are rising, you need it. Healthy people, you see spikes and you get scared. Then you develop fear of food.
Correct.
And that's not a nice way to live. So
I completely agree with you.
Yeah. So I don't think a CGM device should be used by healthy patients or pre-diabetes. You don't need it. You develop fear.
Right.
Yeah. And the body's natural responses spike.
Correct.
It's supposed to happen. So don't get scared. So the whole thing, I think when a patient comes in, and if I could give one thing, get the mechanism right, stop fearing carbohydrates, fix the intramuscular fat, go into remission. Don't worry about managing.
I really want to touch upon the CGM thing. So I'm a big proponent of idli. Okay,
Yeah.
all my reels are idli.
Yeah.
There was one person who said that idli raises the CGM,
Yes.
glucose levels, right? The problem with is that video is very clickbaity, and it will go viral because that is something that is very catchy.
Yeah.
People are talking about this glucose spikes. You eat this is glucose spikes. Are not understanding the power of your GI tract and also your hormones.
Yeah.
As you exactly said that if you're normal, healthy, and even in pre-diabetes, you'll be able to control your glucose spike within your cells. It is just when your A1C is more and you are in that fractured state, that is where you need some help with the CGM.
Yeah. And insights are, because diabetes is very personal. You can't give a same diet to all. Someone's sugar spiking only towards the evening. Now, maybe that's related with stress in the environment. Maybe they're coming home is stressful, that's why it's rising. You never know. But it's very specific, and CGM there can give insights that, hey, change the nutrition around them because we are seeing the rise only at this time. Or during the sleep, it's falling. Change the dosage of the medication. All that is needed. But I think healthy people, pre-diabetes, sold into wearing CGM or doing it because I want to be healthier, you're not going to get insights because you're trying to say that every spike is bad and food is not bad. It's not bad like that.
Right.
Yeah.
Wonderful. Super. It was a wonderful discussion. And
Awesome.
Thank you so much. We learned a lot. I'm sure the audience would learn as well. Thank you so much for your time.
Thank you for having me.
Thank you.
Bye.